Welcome to the Permian Strategic Partnership Podcast. I'm your host, Krista Escamilla. Hello, everyone. Welcome to this week's episode of the Permian Strategic Partnership Podcast. Thank you for your time. We appreciate you being here, and we are really excited to learn more about all of the exciting things that are happening in behavioral health. And joining us to do that is the president of the Permian Basin Behavioral Health Center, Mr. Russell Myers. Thank you so much for being with us today.
Thank you, Krista. I'm really glad to be with you.
It's exciting to be talking in this capacity because we've been listening and hearing about it for years. You're the former CEO of Midland Health and have now transitioned into this role. Let's talk a little bit about this exciting adventure, this exciting partnership with PSP, and what we can expect.
You bet. Well, it goes back to my days at Midland Health. In fact, one of my earliest memories was understanding the flow of behavioral health patients in and out of the emergency room at the hospital at Midland Memorial. And it struck me that we had nothing for most of them. They would often come to the hospital in custody. People act out in public. Someone calls, the sheriff or the police officer comes, does their best to calm them down, brings them to the hospital, and then we sit on them and try to make sure they don't have a medical concern or head injury or something like that, and then try to place them somewhere where they can actually address their mental health issues. And it wasn't here. Oftentimes it was hours away at very high cost, required the officers to carry them off 2 or 3 or 4 hours out of service, to wherever they had to go.
Right.
It just didn't feel like we were meeting our own expectation about serving the whole community.
Right.
Behavioral health was just this big hole that we didn't have anything to offer. And so back in about 2015, we started studying the community. We invited the Meadows Mental Health Policy Institute folks to come and completely analyze the situation in Midland, and we got this massive report on. But what it basically said was, you don't have enough resources. You got a huge need. For people who have the most acute illness, you're probably only serving about 10% of them. Wow. And you can do better. And so we started building awareness and educating people about behavioral health. I think one of the best things that happened to us, if you can say this about a pandemic, is COVID. When we were forced to deal with being in each other's space all the time and total disruption of our social contacts and everything about our lives, it really helped people understand that behavioral health concerns are real. Right. They affect most of us, one way or another. If it's, if there's 3 of us in the room and it's not you or me, then it's the other guy for sure, because that's kind of the prevalence of this. Everybody's family has some element of behavioral health concern, and it's just another health issue that we have to deal with. And so the people began to get that, and so we started down this path. And there's a lot to say about how we got here, but it's that's kind of that's where it starts, with really just raising awareness.
And I'd love to dive into mental health and behavioral health services in a moment. But first, let's talk about how this center came to be with your partnership with PSP and how you found that kind of sweet spot to say, okay, let's go forward and let's raise money and let's build this in our community.
There's so much good stuff happening here, and we were right at the beginning of all of that. PSP is one of the founding partners and really where the ideas were generated to create what we will eventually call the Beacon, which is a substantial development mostly built around healthcare and education out at the corner of 191 and 1788 between the airport and the Wider Noel and UTPB campus. And,
what a great spot, too, to
it's a great visual spot. And
Right.
The idea is we're serving the whole region. That's
Right.
You've heard this from the PSP folks. I know a lot, that everything they do is intended to serve the entire region. It's not a Midland program or a Midland Odessa program. It's the entire Permian Basin where all this energy development is happening and will continue to happen. And the idea is to serve the whole region and improve the quality of life here, make it a better place to live, a place where people can feel comfortable relocating and staying and serving the energy industry the way it needs to be. So when this vision came out of PSP and some really visionary folks there to create this medical community on that site. About the same time, our behavioral health plans were coming together.
Great.
I mentioned COVID. The first real money that made it possible to believe this vision could happen, to create a real legitimate full-service behavioral health center, came from the 21 legislative session.
Okay.
The ARPA, the American Rescue Plan Act, that was the first big COVID recovery plan funded by the federal government. And the way it worked was states and communities were given big pots of money with some fairly loose guidelines about how to use it, the whole objective being to recover from COVID.
Right.
And at the top of the list of things that the federal government listed was behavioral health concerns. And so we said, okay, the state's got $16 billion they haven't allocated yet.
We'll take
We
some.
need to go get some of that so we can build our facility. And at that
Right.
time, the folks at Diamondback Energy, which is one of the primary partners in PSP, had identified 250 acres of property, surface that they owned. They weren't giving away minerals, but but the surface they were very happy to share because the surface doesn't have a lot of value to them other than, a few well pad sites. And so they, working with PSP, had identified this acreage to devote to this medical venture. And we said, okay, we'll put our hand up. We'd love to have some of that.
Yes.
That helps us get this behavioral health facility off the ground if we don't have to pay for the land, and we know it can benefit from other providers.
That's
nearby.
huge.
So it
Right.
was a massive step forward for us.
Wonderful.
So between the Diamondback gift and the first money coming from the legislature, that made this thing real. And so we started marching down the road to designing it, planning it, trying to figure out what the whole thing would cost. And PSP, even furthering the idea, was one of our first major donors
Oh, that's wonderful.
to help supplement the state money with what has turned into almost $100 million of private money to help make this thing happen.
And the goal, you're at over 200 million, still looking for an additional 10 million.
That's right. We have a $232 million project, all in, and we've raised about 223 or 224, so a little under $10 million left to reach our goal. And it's about half state and half private, and it's been tremendously well supported.
That's fantastic. The opening date, you are set for April of 2026.
That's right.
But
Not a moment too soon.
Yeah, I bet you're ready.
We are ready.
But there's already the ball rolling, and there's going to be some pre-services that are available, correct?
Yes, we are. We've got a whole lot of things. We've got to have to talk about workforce development
Yes,
later on and all
yes.
that. But as a component of that workforce development, one of the most exciting parts of it is that PSP, again, along with our friends at the Scarborough Foundation, they've devoted a significant amount of money to scholarships at the University of Texas Permian Basin in a variety of fields, but our specific interest is in counseling and social work.
Okay.
Master's level people who have not had really great support in the past. We've supported undergrads,
Right.
really well, but to procure a master's that will lead you to a license where you can be a counselor, you can be an independently operating social worker, that took a lot more effort. And so they've scholarshiped people at UTPB, and when you finish those academic programs, there's still a substantial requirement for clinical work before you can get a license. So finish your academics, go into the community, spend 3,000 hours working in some kind of behavioral health related setting, but you're not creating billable time. And so it's been really hard for small agencies to hire those people because they can't get reimbursed for the work they do. They appreciate the work they do, but
Right.
they can't get any money for it, and they have to pay them, and they all have to survive. So we've put together a plan to formalize that postgraduate effort in what we call a fellowship, and to secure private funding for that year and a half or so of extra time that people need to work before they can get licensed.
That's fantastic.
And in addition to that, plug them into settings where they can work with primary care providers. One of the things that we've heard for years as we've been raising awareness is our local doctors, our family docs and internists and OB-GYNs, they all have patients in their practices who need some level of mental health intervention. Oftentimes, people who can't manage their physical disease because their mental health concerns are in the way.
They're
and
tied
not
together.
being addressed.
They truly are
That's
tied
right.
together.
If you can't think straight all the time, then you can't remember to take your meds. You're not going to come back to the doctor when you need to. If you've got a chronic disease, that can be life-threatening.
Right.
And so those things are tied together. The doctors know that, but there was no real way to help them. So now we're thinking we can plug these fellows into primary care offices, work at the doctor's elbow. We can even generate, we think, some revenue for that to help pay for them. But even if we can't, just to have that extra resource in a primary care office where it's being identified by the physician, and then he's got an expert or a young expert in the office who can do something about it. And it helps with one of the most fundamental problems with behavioral health services, which is stigma. People don't want to acknowledge that they have a behavioral health concern. They don't want to tell their family they're going to see their psychologist or the psychiatrist. But nobody objects to going to see their family doc or doing their well woman visit once a year or whatever normal physical health management tools you use. And so if in that environment you're also getting your mental health needs met, maybe
Two for one.
Maybe we've got it figured out.
That sounds amazing. And I'm glad you brought up stigma, because you and I were talking about this a little bit earlier today. Our generation, it was there. There were mental health, needs during our generation. They just weren't met. And now it's more talked about. Now it's okay to not be okay and to get help. And I want to talk a little bit about the difference there, just generational and why this is so important now more than ever.
Yeah, I certainly, there's no question that we know that 1 in 5 people has some level of mental health concern. That didn't just happen, overnight. We've always had those concerns. We've not acknowledged them necessarily. They've affected our health in a lot of different ways, and many of us, certainly people my age, haven't ever acknowledged them very well, unless they were just so acute that you couldn't help but acknowledge it. And in those cases, sometimes people got institutionalized. Oftentimes, far too often, there were criminal behaviors associated with it, and so those people end up in jail. That's not good for anybody. And so our ability to acknowledge that those issues are real, that they really aren't any different from diabetes or from high blood pressure or from any other disease process that affects a person that they didn't choose, but can be managed. We're really coming around to a different understanding of that. Certainly the current generation of young people and young adults grew up acknowledging that, and COVID helped reinforce that with all generations. But we're a very different society now than we used to be. That can swing too far. You don't want mental health concerns to be an excuse not to get on with your life. But we really think that a lot of people can benefit from at least some contact with a counselor. Many people who have diagnosable psychiatric conditions, they can be managed on medication very well. But if you never get to a psychiatrist, you never see someone who can diagnose and prescribe for you, then you're going to be struggling with that, and it's going to affect everything in your life. And so we're hopeful that tide is turned, and we're going to continue to be a part of that, reinforcing the importance of it. A big part of what we'll do in the new Behavioral Health Center is community education. People still have more to learn about the reality of behavioral health concerns and how to get help how to identify what you have, and then how to get help for it when you need it.
Right. I think that is so key, is really the communication and knowing when you should seek help. So I think that's a good topic right now to talk a little bit about is how should you go about if you know a family member or if you yourself are concerned but you don't know the next step to take. Because I think that's a lot of it is, like you said, the communication is going to be important with the community. So how do you know when, okay, you know what, I am struggling in this aspect and I really do feel like I could benefit?
It's really vital that people understand that. And we don't have the kind of access points yet that we eventually will, but there are providers here that do a really nice job. They're just limited in their capacity.
Because they're full, right?
Most of them are full, are very full, and long waiting lists. And getting to see a psychiatrist right now is very difficult because there's so few of them. But we're doing things to address that. One of the important aspects of the Behavioral Health Center is the fact that it's going to be the teaching home for Texas Tech. Texas Tech has a psychiatry program here in the Permian Basin that's still relatively small. They train some residents, they train some fellows in child and adolescent psychiatry, but they're not too many years into it, so they haven't really produced a whole lot of doctors to fill that pipeline. But that's coming. And as the Behavioral Health Center comes to life, we'll have a home for tech there. We will grow their psychiatry complement dramatically. They started with only 2 psychiatrists here in the region, and by the time we open, we hope we'll have them at 11.
Oh wow!
We've gotten them up to 5 now. We're helping them to recruit. We've got some local philanthropic funding to help with the cost of recruiting, but that's going to be a key access point. Psychiatrists and supportive personnel, counselors and social workers in the Texas Tech environment. And that's one of those places you can call. You can seek help. Now, if you call them today, they're going to tell you, you're going to have to wait a while for an appointment because we're not quite up to full staffing yet. But eventually they will be.
And that's a great point, is workforce concerns, because I know a lot of times, there's, hopefully there's people listening in all parts of the world right now. And if you are in this space, West Texas is a great place to come, and you will you'll be fully booked right off the bat. I mean, we need you. So let's talk about workforce and how we can get more retention, more people to stay here after education, and to choose West Texas as their place to practice.
That's key for all of us. Not just in behavioral health, but across all aspects of really the entire professional world here, not just mental and physical health, but the oil and gas industry. All of us who are dependent on a workforce have realized that the primary target is the people who are already here, people with roots in the area, people who are getting educated here, making the environment such that they want to be here and it's positive for them to stay here.
Right.
So that's really important. And we're doing a lot of those things across the whole continuum. We talked about psychiatry, actively recruiting there. One of the big components of that recruiting effort is trying to keep the residents as they finish. There's a couple of them who actually grew up here, and we really want them to stay here. Yeah. They're prime targets for us. So we're hopeful about that, but it goes beyond that. We talked about the UTPB master's program and counseling and social work. That's primarily local people. We want to continue to grow that and give those people good, solid opportunities, not only while they're being educated, but afterwards, in the hospital, in private outpatient settings. There's lots of places where those folks can work, and we want to make sure we expose them to all those opportunities.
Absolutely.
We train a lot of nurses here locally. In the psychiatric hospital, we don't have the intensity of nurse staffing that you do in an acute care hospital, but there still are nurses required to manage medications, to interact with the patients regularly. And so we actually are standing up through the Midland Health Education team, a nurse residency program to train new nurses to be psychiatric nurses, much like we would train somebody to work in the emergency room or in the ICU. Psychiatry is a specialty, and we can train them using those resources to prepare those graduates that we already have here in the region.
A little cross training.
And then I think the most important role really is that frontline role. In the behavioral health center, we'll have a job called a behavioral health technician, who in the ancient past might have been called an orderly. But these are the people who are in the environment with the inpatient behavioral health center patient population at their side during their activities, while they're in therapy, when they go to lunch, when they're outside, getting some exercise. The biggest number of people and the most important ones in interacting with patients day to day. Midland College has worked with our team to develop a special curriculum to prepare people to do those jobs.
Oh, great! Because I was going to ask, how do you prepare for that?
It's great, and they're actually underway. They have their first class underway now. Started this semester. They started with 12 people. They'll graduate most of those eventually, but they can have as little as 2 semesters worth of education and be prepared. They'll get a certificate, and they'll be prepared to work in our facility. Wow. They can parlay that into an associate degree where they get a little further down the line, they get a little higher level of certification, they can make more money and do more things. And then those are natural paths into a career in counseling or in social work or some other aspect of mental health care delivery.
So the only prerequisite would be to be a high school graduate.
High school graduate, and have an interest.
And then have an interest.
And you got to pass a drug test and those things like anybody else does. But it's a very easy access right here in Midland. Most students can go to a program like that at Midland College for little or no cost. And there's a guaranteed career path on the other side.
I love that. That is fantastic.
We've tried to address all the points in the continuum to make sure that, because this is really a startup business in a lot of ways. When you've done that,
yes.
You know how difficult it is.
There's a lot to do.
There is, and if it's not a business that already exists in the community, then there's not a workforce that knows how to do it. And so a big part of what we do is recognize that we've got to create our own workforce.
Right.
We hope to find a few experienced people to give them mentoring and guidance, but we're going to be a young, minimally experienced group when we first start, because we're starting from zero.
But what a great opportunity to be in on the ground floor.
Great opportunity, absolutely.
And I want to ask you, what are your hopes and your goals when you look long term, when you see this 10 years from now? What do you hope the Behavioral Health and Mental Health Center will look like? And the repercussions of it, like how will it trickle down into the community?
I think it's got dramatic potential to change our life in a lot of ways. But to start with what it's going to look like, I think it'll be fully staffed, clearly. And
Yes.
there are things we're not doing. One of the things that came to mind immediately that we just aren't quite ready for, don't have the resources to produce yet, but eventually will, is a residential center. When you go to an acute hospital setting in behavioral health, you're probably going to be there for 7 to 9 days. That's the average stay. And then there'll be step-down outpatient services you'll take advantage of once you've been discharged. But if you have really serious mental illness and you need a long-term place to either to live for the rest of your life, or more importantly to live while you transition back into productive work and the ability to live on your own, and that's something we're going to need to add. A place where you could live for 6 months,
right
so
that's
on the site.
That's not in phase one.
That would be
that would be
that's
the
phase two
dream,
thing, but
the
that's
big goal.
When you ask for dreams,
Okay.
that's one of the big dreams
Love
is to have a legitimate residential center, maybe one for adults and one for adolescents too, because one of the huge things that's really going largely unmet is the need for adolescent and child level behavioral health services, and that's a real focus for us. So those will be part of the dream. But backing up a couple of steps from that, what I hope is that we make the inpatient acute center less important. That we don't have people who are getting arrested because their mental health concerns are going unmet. We're getting those people into care before they get to that crisis point.
So the outpatient is really where the focus.
That's exactly right. Outpatient, preventive, early intervention, making sure that all the access points are in place so it's really easy for people to get into care when they need it. That's years of work. We're coming from a very, very minimal capability now. But that would be the goal, that we treat primary behavioral health services just like we treat primary physical health services, and we expect that everybody has immediate access to a primary care provider when they need it, and they get evaluated at early points. For children, we empower the schools or even preschools before school happens, to test kids and get them on treatment when they need it, so that they have a chance to succeed. And at the end of the day, what we want is for people to be productive members of society and to live lives that are fulfilling and not bear the burden of mental health concerns that just prevent them from enjoying their lives.
And that's the hope, right?
Lives. That's exactly right.
That's what I mean. I feel like we want for everyone to be, to live that life that they want to live and feel happy and whole and feel productive in society. With that said, let's talk. You mentioned children because I mean, to me, kids, that's where it's at. That is, we need to focus on children because they are our future. And I feel like kids, they may not know how to express what's going on, those feelings. So how do you talk to your kids about mental health? I know they're seeing it more in social media now than ever before, but that's different than having a conversation as a parent or a grandparent.
Yeah, I'm certainly far from an expert, but I can tell you a big part of it is just being willing to have the conversation at all, to recognize that anxiety and depression are real parts of life for many of us, and they don't make you weak or less than your peers. They're just things we have to manage, and there's lots of different ways to manage those things. They don't necessarily require professionals, but it begins with acknowledging the concern. And what we hope is that we can empower parents with the resources such that when they and their children or their pediatrician recognize that some intervention is required, then they know where to get it. They can get it readily, regardless of their payer class, with their ability to pay, even if they can't pay much of anything for the care, that they can still have access to it. All walks of life, all socioeconomic levels of folks are affected by this, and we've got to have answers for all of them.
Yes.
With regard to children, Texas Tech has a real commitment to child and adolescent psychiatry. There's a fellowship, and in fact, the psychiatrist there who started it as a child and adolescent boarded psychiatrist. He told me years ago that, our best shot at creating healthy kids and avoiding the crises that come up in adolescence is to identify them early.
Okay.
Because you can tell when there's a troubled 14-year-old that you really can't reach.
Right.
That was probably a troubled 3-year-old.
Right.
And if we had started then, we had a much better chance of saving that 14-year-old and avoiding all the myriad of crises that can come up with adolescence.
Yeah, I love that the education will start earlier and earlier, that rather than just trying to get it later on in life. Let's start early and identify.
That's
and
right.
help.
And now, today, if you have a young child who's in crisis and really needs to be hospitalized and needs some intensive care, there's virtually no place to send them. And with our new behavioral health environment, we'll be serving children as young as 6. We hope we don't have a lot of those, but if we do, we will have a place for them. And we'll segregate them from adolescents and put them in a safe, protective environment and have dedicated resources for those children. And then other resources down the road, outpatient programs, counselors who are trained to deal with children, testing resources, which are really hard to get now. We'll have more of those available. So we have lots of ambition about doing a better job for children and for adolescents.
I think that is fantastic, and we're looking forward to April of 2026. Is there anything that we can do as a community to support your initiative, or anything else you want us to know about it? We're so appreciative of PSP and Diamondback and all the organizations and Scarborough Foundation that are helping support this. But is there anything that any of us, if maybe they're hearing this for the first time today, go, hey, I can help, or I would love to help? What
Sure, there's lots of ways that people can help. I think we still need some money. We are about $10 million short of our fundraising goal. We have a website that tells you a little bit about what we're doing. It's at permianbehavioral.org, permianbehavioral.org.
Okay.
So you can donate through the website if you're so inclined. But more than anything else, talk about it. Talk to your friends about it. Encourage people to recognize that this is real. It's important. The stigma, everything we can do that reduces stigma is a positive, because it opens people's eyes to not only to the need, but it breaks down those barriers to actually seeking care when you need it. And so all of us have a role to play in that. All of us should understand that every family has somebody. Doesn't mean they have to be hospitalized, but every family has somebody in need of some level of behavioral health intervention. And don't be afraid to seek it out. Yes. Don't stigmatize the person because they need it. Support your family members when they choose to go for therapy or go and see a psychiatrist, because it'll make a difference in their lives and in yours.
Absolutely.
And we can all do that.
Absolutely. I love that. Well, thank you, Russell, for sharing this information today, for doing what you do, and for pouring into our community's health for so many years. I'm not sure what year you're on. What year in in health are you in?
In healthcare, it's about 40.
40
I've
years.
been here for 22, so yeah.
Well,
I'm getting close to the end. This is my last big project for sure.
Well, you've done so much for our community. We appreciate everything that you've done and continue to do, because now you're helping the next generations to come with this new center. And so thank you for that. If anybody would like more information, please go to permianbehavioral.org and donate. Find out more, just see how you can support this. But in the meantime, educate yourself. I think that's the key thing, is that just get educated on how you can help now and help your loved ones and really help support this initiative. And we've said it before, we're all better together. And this is just another way that the Permian Basin is being better together, by bringing those two, the mental and the physical health, together. And
can't thank our community enough for the support we've already gotten. So thank you.
All right. Well, thank you so much. And thank you for listening. Please share this with someone that you love, someone that you think can benefit from hearing about this project. And let's just continue to grow the Permian Basin together. We are better together. And remember, the future lies in the Permian. And I know you know that. We know that. And we're excited that everyone here listening today knows that. So let's continue to do the good work in the Permian. And we look forward to seeing you next time right here on the Permian Strategic Partnership Podcast. Russell Myers, thank you so much for your time today.
Thank you, Chris.
And you make it a great day. Thank you for listening to the Permian Strategic Partnership Podcast. For more information, go to permianpartnership.org.